Hello, I'd like to talk to you for a moment about lung cancer screening. Because of your age and because you've smoked or are currently smoking, you have a higher chance of getting lung cancer than someone who does not. Lung cancer is very serious. It causes more deaths each year than colon cancer, breast cancer, and prostate cancer combined. Lung cancer is dangerous because many people do not feel sick at first. Often there are no warning signs until the cancer has spread to other parts of the body. When lung cancer spreads, it's much harder to treat. Some people may be eligible for a test called a low-dose CT scan. This scan takes pictures of the lungs. It can sometimes find lung cancer earlier when it may be easier to treat. A low-dose CT scan can help, but it's not a perfect test. Before you decide, it's important to know the limitations and the risks. About 1 out of every 4 low-dose CT scans will show something abnormal, which may or may not be cancer. Most of the time, the scan finds a small spot called a nodule. A nodule is a small lump or spot in the lung. It can be left behind after an infection. You can think of it as like a small scar. Most nodules are not cancer, but it can be hard to tell the difference between a small cancer and a harmless nodule. If a nodule is found, you may need another CT in a few months to see if the nodule grows, or a biopsy, which is a procedure where a doctor takes a small sample to test it. Sometimes the scan finds a cancer that grows very slowly, so slowly that this cancer may never have caused problems during the person's life. The hard part is we cannot always tell which cancers will cause harm and which will not. A low-dose CT scan uses a small amount of radiation to take pictures of your lungs. Radiation can increase a person's chance of getting cancer. The amount of radiation from a low-dose CT scan is small. It's about half the radiation exposure people receive each year from everyday life. We do not know for sure if the extra radiation from low-dose CT scans will cause cancer in some people. Doctors and other experts continue to study the effects of radiation exposure.
Having a lung scan just wasn't part of my purview. I know about colonoscopies and breast exams and that type thing, but the lung scan, I never even thought about.
The challenge with lung cancer is that if you have lungs, you can get lung cancer. It's not about smoking or not smoking. It's if you have lungs. And so it's even more complicated if you have a family history.
It's very important, painless, easy, and I think that it's an added scanning tool for our community that can help save their lives.
We've seen tremendous advancements in medications and treatments and clinical trials over the last 15 years. The outcome is very different now than it was 15 years ago for my mom or for my grandmother. Early detection is essential because the sooner that cancer is found at an earlier stage, it's more treatable.
I wish everyone would actually participate in it because it's important.
It's important to know how you can best take care of yourself. Live that long life, but if you sit back and wait for someone to tell you what to do, you're missing opportunities to be with your grandkids, to be with your family and friends. If you have not been screened, this is something that you need to follow up on.
Screening works best when it's done every year. Yearly screening gives the best chance of finding lung cancer early. Screening may not be a good choice for you if you have other serious health problems that would keep you from getting treatment, or you would not want treatment even if a lung cancer were found. If you smoke, quitting is the best thing you can do for your health. And if you've tried to quit before and it didn't work, that doesn't mean you failed. Many people feel that way because most people were never given the right kind of help. Nicotine is addictive and urges can be strong. Trying to quit with willpower alone is hard, and it's rare for people to quit that way. The good news is treatment works. The best results usually come from using 2 things together: medicine to help with the cravings and withdrawal, and support from a trained professional to build a quit plan and relearn daily life without tobacco. When you're ready, we can help you take the next step. We can talk through what's worked before, what got in the way, and what support fits you best. You don't have to do this alone, and every quit attempt is progress. Lung cancer screening is a choice. Quitting tobacco is the best step you can take for your lungs. Together, they help us find problems early and lower risk moving forward. This video gives you information, but you decide what's right for you. Talk with your healthcare provider about screening, quitting, or both. We're here to help.